Can dental implants fail? Yes, they can. And we'll go over a couple reasons why they do. Hey, I'm Dr. Park here in Nuvia in Dallas. And today we're going to talk about what can cause implants to fail. In my experience, implants fail due to poor oral hygiene, not abiding to the soft food diet, medical issues such as diabetes, and not wearing your night guard. Well, with regards to oral hygiene, if a patient is not super flossing or water picking underneath the prosthetic, you can get a lot of plaque buildup, food buildup underneath the prosthetic. That bacteria can travel down to the implants, leading to implant failure. So it's very important that you super floss, water pick, use a soft bristle toothbrush and brush that area between the prosthetic and the tissue, and use any non-alcoholic mouthwash. I always recommend non-alcoholic mouthwash because alcohol is more harsh on the tissue. Another reason why dental implants can fail is if a patient does not abide to the soft food diet. Dental implants take approximately 2 to 4 months to fully osseointegrate with your body. Some patients can get impatient because after 2 weeks, the implants probably will feel fully healed because the soft tissue is closed up. Everything looks good, feels good, but really the bone is integrating with the implant. That in itself takes 2 to 4 months. And if you're eating beef jerky, if you're eating steak, if you're eating hard nuts, crunching on ice, then that can create a lot of micro movement with the implants, and those implants will not be able to integrate with the bone. Some soft foods I recommend: mashed up avocados, mashed up bananas, scrambled eggs, anything you can mash with your fork, you can eat it. So there's a variety of medical conditions that can cause implants to fail, but one of the more common ones that we encounter is diabetes. If you are diabetic and your A1C is uncontrolled and above 8, you have a higher risk for dental implants to fail because your body will not be able to integrate that titanium implant into your bone, which may lead to implant failure. Simply put, A1C is a measure of how well your body is controlling the sugar in your blood. So if you're diabetic, you want your A1C to be below 8. That way, the implants have a greater chance of osseointegrating.
So here at Nuvia, when you receive your new permanent teeth just 24 hours after your surgery, you also will receive a night guard. And Dr. Park is going to break down exactly what that is and why it is so important.
So a night guard is a occlusal appliance. It's basically a mouth guard that you wear at night to protect your prosthetics and your implants. The reason why it's very important is because throughout the day when you're eating and talking, you'll notice your teeth only touch approximately a couple minutes throughout the day. But if at night you're clenching and grinding, your teeth are doing this at night for hours and hours, you're putting a lot of wear and tear on the implants and on the prosthetic, and that can definitely lead to biomechanical failure of your implants. Smoking can definitely affect the health of your implants and the tissue. So I don't recommend smoking, vaping, or chewing tobacco. Throughout the day, if you find yourself in a stressful situation and you're clenching and grinding your teeth, that can lead to overloading and overworking your implants and prosthetic. So that can also cause implant failure.
Do dental implants hurt? Well, that's a whole nother video. But it doesn't hurt to find out if you're eligible. So click the link right here and find out if you're eligible for Nuvia's permanent teeth in 24 hours and take our 60-second quiz and find out right now. If you want to keep watching some videos, keep doing your research, click the video down there and keep watching.
Super floss.